1. Anxiety disorders. Anxiety disorders are the most common type. It's like your brain always thinks something bad might happen. Even when everything is fine, you feel nervous before an exam. That's normal. But if your heart races, you can't breathe, and you feel like you're in danger, even when you're safe, that might be an anxiety disorder. Some people worry about everything all day. That's generalized anxiety. Some people freeze when they have to talk to others, social anxiety. Some avoid elevators, dogs, or heights. Those are phobias. And some feel like they're having a heart attack out of nowhere. That's a panic attack. Anxiety isn't always logical. It's just loud. 2. Mood disorders. When your feelings get stuck in overdrive or freeze mode. You've probably heard of depression. It's not just sadness. It's waking up tired. Even after 10 hours of sleep, it's losing interest in the things you used to love. And sometimes it's feeling nothing at all. Then there's bipolar disorder, where you swing between two extremes. Feeling like you're on top of the world one week and unable to get out of bed the next. And no, it's not just mood swings. It's exhausting, and it's real. 3. OCD and related disorders. OCD, Obsessive-Compulsive Disorder, is often misunderstood. It's not just about liking things clean or organized. It's about having unwanted thoughts that won't go away and doing things over and over to feel less anxious, like washing your hands again and again, or checking the door 20 times. You know it doesn't make sense, but not doing it feels too risky. There's also body dysmorphic disorder, where you can't stop thinking about a tiny flaw in your appearance, or hoarding disorder, where you feel the need to keep everything, even if it makes life difficult. These are not quirks. They're conditions that take over your day. 4. Neurodevelopmental disorders. These usually start when you're young. They affect how you learn, focus, or interact with others. ADHD makes it hard to sit still, pay attention, or finish tasks, not because you're lazy, but because your brain is wired to move fast. It's like trying to do homework while 25 tabs are open in your head, and 10 of them are playing music. Autism spectrum disorder means you might see, hear, or feel things more intensely than others. You might prefer routines. You might struggle with social rules that everyone else just gets. That doesn't make you weird. It makes you different. And that's okay. 5. Trauma and stress disorders. Not all pain leaves a bruise. Sometimes, something really scary or upsetting happens, and your brain doesn't know how to move on. Post-traumatic stress disorder, PTSD, is like your brain getting stuck in survival mode. Loud noises, smells, places, anything can trigger a memory so vivid, it feels real all over again. Even big life changes like divorce or losing a job can cause adjustment disorders, where your emotions feel too big to handle. These disorders don't make you weak. They mean your brain is trying to protect you, but it needs help calming down. 6. Dissociative disorders. Ever felt like you were floating outside your body, or like life didn't feel real anymore? That's called dissociation, and it happens when the brain disconnects to deal with overwhelming stress. In depersonalization, you feel disconnected from yourself. In derealization, the world feels foggy or dreamlike. And in dissociative identity disorder, the brain creates different parts or identities to cope with extreme trauma. It's not pretending, it's survival. 7. Psychotic disorders. These are some of the most misunderstood. Schizophrenia and other psychotic disorders affect how you think, feel, and understand reality. You might hear voices that aren't there, see things others can't, or believe something that's not real, like thinking someone's watching you through your fridge. These experiences can be scary and isolating, but with support, people can absolutely live meaningful lives. 8. Personality disorders. These are long-term patterns in how someone thinks, feels, and relates to others. Some people feel emotions so strongly, it's hard to control them. That's borderline personality disorder. Some avoid people because they feel not good enough. Avoidant personality disorder. Others may struggle with empathy and constantly need admiration. Narcissistic personality disorder. These patterns usually start in teenage years, and they're not about being bad or toxic. They're ways of coping that got stuck. 9. Eating and body disorders. These disorders are about more than food. They're about control, fear, and how you see yourself. Some people eat very little because they fear gaining weight, anorexia. Some eat a lot and then try to get rid of it, bulimia. Some binge eat and feel deep guilt afterward, Eating disorders affect people of all shapes, sizes, and genders, and they're serious, but treatable. So, those were the major types of mental disorders. If you relate to any of this, don't panic. You're not crazy. You're not broken. Mental health is just as real as physical health, and getting help is brave, not weak. So whether your brain is anxious, distracted, moody, numb, or just tired, you're still you, and you deserve to feel okay. Share this video with someone who needs to hear that. And if you liked it, hit subscribe for more stuff like this.